There is a tidal wave of demand for the vaccine, a demand that so far health officials have struggled to meet. In Iowa, more than 2,000 free swine flu vaccines were snapped up in less than 4 hours, leaving people across the country asking, why is there such a shortage? Here's David Muir.
No oinking, no.
The CDC now says the H1N1 vaccine is behind schedule. Originally hoping they would have 40 million doses by the end of this month. Now there could be fewer than 30 million.
We don't have the vaccine, and we don't know if we're going to get it next week, next month, or when to tell our patients to come.
More than 80 children have died of the H1N1 virus in the U.S. That's already more than the number who die every year from seasonal flu. One of the young victims, 10-year-old Summer Rockefeller, a fifth grader from Grovetown, Georgia.
She went in initially with some flu-like symptoms, and then there's some pneumonia that developed, and then lots of other medical complications during the 6 weeks that she was there.
And there's the mysterious case of 5-year-old Alitza Ortiz Sanchez of San Diego. The kindergartner had been sick for 48 hours before going to the ER. While waiting at the hospital, she became much sicker, crying, passing out, as her heart stopped. Doctors believe the virus had infected her heart muscle, and there was no time to administer antiviral drugs.
This is the one and only case since the whole pandemic started of an unexpected death.
With cases like this one, federal authorities continue to tell parents that they should get their children vaccinated, and that despite the delay, there will be enough to go around.
In a very reasonable amount of time, everybody who needs a vaccine will have it, and they shouldn't panic if they can't get it the day it's out.
Perhaps easier said than done for the parents already concerned about a new vaccine, who must now deal with a delayed timeline, too. For Good Morning America, David Muir, ABC News, New York.
Joining us now, our senior health and medical editor, Dr. Richard Besser, former acting head of the CDC. Don't panic. I know that's what we've been saying, and people don't want to panic, but they could calm their nerves a little bit if they knew when the vaccine would be available. So what are you hearing right now from the CDC?
You know, vaccine has started to move, but not nearly as fast as anyone would like. And what people are looking for, in addition to vaccine, is information. What I heard from CDC on Friday is that it really will be the middle to the end of November before there's enough vaccine for everybody who wants it. And until then, you have to really focus on the other measures.
And the other measures, of course, are?
That's right. Washing your hands,
right,
covering your cough, staying home if you're sick, keeping your children home from school if they're sick, and then having a treatment plan so that you know what you would do if you get the flu.
We can't say that enough.
That's
I mean,
right.
That really works. Rich, the 5-year-old in San Diego, when parents see this case, it breaks everyone's heart. But are there clues? Is it a new, more powerful strain, or is there anything we could learn from this tragic case? You know,
we hear about these cases around the country, and they're so incredibly sad. Fortunately, they're very rare. At this point, there are no clues that I've heard of from this case in San Diego. This was a girl who was otherwise well. There are things parents should look for, though, when their children have the flu. If they're getting better, and then they start to get worse and have a high fever after they're improving, that's a time to go see your doctor. Or if your child ever has trouble breathing or looks a little dusky or blue around the lips, see the doctor right away. If your child or you as an adult has an underlying medical condition that puts you at greater risk.
Such as?
Well, if you have diabetes, if you have asthma, any type of heart disease, those are things where you should have a treatment plan now before you're sick, so that either you have a prescription for Tamiflu at home or you and your doctor have agreed what you're going to do if you get the flu.
And a study really caught your eye that could undermine the effectiveness of the vaccine.
Well, this was very interesting. It was a study that came out Friday, and it looked at whether giving people Tylenol at the time that they got their shots would reduce fever after their shots, and they found that it did. Unfortunately, they found that it also reduced the immune response to the vaccine. And as a pediatrician, for years and years, I've always said to parents, well, after the shots, take some Tylenol, give it 4 times a day for a couple days, and that'll reduce the reaction. Well, that's going to change. That's going to change what people do now in terms of that. And what I would say to a parent now is, your child may have fever for a day or so before following the vaccination. But unless it's high, like 103, or unless your child has a problem with like seizures after a fever, don't give that medicine right up front. You're going to have to suffer for a day, but after that, you'll feel comfortable your child will have responded well to the vaccination.
Good information there as always, Rich. Thanks so much. Appreciate that.